Biostatistician at Memorial Sloan Kettering Cancer Center. I've been there for almost 8 years now. And in that role, I collaborate with oncologists and surgeons and radiologists and all other types of clinicians working in cancer research to plan their prospective research studies and analyze retrospective data. And it's a really fun job. I use R for that, and I rely very heavily on R Markdown, which saves my life every time they're like, I changed one data point, and I can just run my reports again. So I will be talking today about some survival analysis stuff, kind of introducing the topic and talking about ways that survival time data is commonly misinterpreted or misanalyzed, and some of the ways you can use R to do it correctly. Okay, so the most common type of data I encounter in my work at a cancer hospital is survival time data. And survival time data is any type of data that has a start time. So in the work I do, that's commonly a date of diagnosis, or a date of treatment start, or a date of surgery. And then some amount of time passes, and there's an end date at which an event of interest occurs. And so in the work I do, that's commonly a death, or a disease recurrence, or disease progression, and there's a date associated with that. So it's kind of obvious that this type of data would be common in cancer research or in any other fields of healthcare research, but it's actually common across many fields. And kind of sometimes I think it can be a little sneaky, and so people don't know they're dealing with data that has a time component. But in other healthcare fields like cardiovascular research and HIV/AIDS, this is common. It's also very common in social science research. There's a lot of social science endpoints that actually have a time component. Your event is happening, and maybe today you ask someone a question and the answer is no, but the answer could be yes tomorrow or next week or next month. And so this time component is important to consider, and it's very, very commonly analyzed incorrectly. So like I just mentioned, survival analysis is common in a lot of different fields, and so that means it goes by a lot of different names. And we call it in healthcare survival analysis most of the time, sometimes time to event analysis, but it can also be known as reliability analysis, duration analysis, or event history analysis. And so these are just some terms you can watch out for that could clue you in that there's a time component to something that you're reading about. You guys, my clock never started, so just FYI. I'm going to talk for 20 minutes, but. Okay, so in cancer, there are kind of two main questions that are commonly of interest to patients. So one of the main things that we do is we analyze data, and the goal is often to generate some numbers that doctors use to convey prognostic information to their patients. So it's really important to get this right. And two of the most common quantities that are of interest are the probability of surviving a certain number of years. So this could be 1 year or 5 years or 10 years. And then some estimate of on average, how long do people with a certain disease tend to live. So just a very simple example to start. We have 5 patients here, and let's say we're interested in the 5-year probability of survival. Well, patients 1, 3, 4, and 5 were all followed for the full 5 years. They were alive at the end of that 5-year follow-up. And then patient 2 died at 3 years. So this is pretty straightforward. We can just take the proportion of patients who died, 1 out of 5, and estimate the 5-year probability of survival of 80%. So no problem here. This is straightforward. So the problem comes in and the complexity comes in when that's not exactly the case. So in the same simple example, I've altered the data for 2 patients. So we still have patients 1 and 4 who are followed for a full 5 years, and they're alive at the end of follow-up. Patient 2 died at 3 years. But now patients 3 and 5 have been followed for less than 5 years. And the last thing that we knew about them is that they were alive. And this is what's known as censored data. And this can occur for a lot of reasons. It can happen because patients enter a study late, and so then the study ends and they haven't been followed for the full amount of time of interest. Or it can happen because they entered at the beginning, but for some reason they were lost to follow-up. Maybe they moved out of the area or some other reason. And it's very common to have this kind of variation in survival time data and then in follow-up data. And then we want to estimate the 5-year probability of survival. But for patients 3 and 5 in this example, at 5 years, we don't know if they were dead or alive. All we know is that at some point in time before 5 years, the last thing we knew about them is that they were alive. So now it's not so straightforward to get these estimates. So I'm going to be using an example today throughout my talk before I get into some R code and some results. It's a kidney cancer data. There's 2,119 patients in this data set. It's a retrospectively sampled. And we're interested, the event of interest is just death from any cause. So we're interested in overall survival. So I'm going to be using two main R packages. The first is the survival package. And the survival package has all of the functions that you need to estimate quantities associated with survival, or do regression models with censored data in R. And then the second package I'll be talking about is the SurvMiner package, which is a great package for visualizing survival data that uses ggplot in the background. So just to take a look at a little bit of a couple of the functions that we rely on. So in this data set that I'm using as an example, there are only a few variables in there. One is a time variable. And so this is a variable that's calculated from our start date, in this example, date of surgery, to the end date, which is the date of death for patients who died, or the date of censoring for patients who were last known to be alive. And this is the variable I'm calling OS years. And then there's an indicator variable, which is 1 if the patient died and 0 otherwise. And these are the two main variables we need to do our survival analysis. So you'll see in that first line of code, we have inside survfit, we have a formula. The left-hand side of the formula is the surv function, which takes two arguments. The first is the time variable, and the second is the indicator. And then the right-hand side of the equation is just 1, because I'm just interested in the overall survival right now. And then survfit is the function that generates our survival curve. And the rest of that code is just plotting stuff. The ggsurvplot function is the main function from the SurvMiner package that does this nice plotting. So we have this survival curve now, and it's a step function, actually. Every point in time where an event occurs, there's a down step. So if multiple events occur at one time, there will be a larger step down. And the shaded area around it is a 95% confidence interval. We have on the x-axis our years from surgery, and the y-axis is our survival probability from 0 to 1. You can see below the plot, I have also included a table of the number at risk. And this is important because you can see at time 0, it's our full sample size of 2,119. But as that time goes on, patients die and patients are censored, and we have fewer patients left in our analytic set. And so those estimates start to be a little more uncertain. And it's good to keep track of kind of how many patients are going into any estimate you're making. So if you're trying to make inference out at 15 years, you can see that you're not as sure about what those numbers are, because we only have 27 patients left in our data at that point. Okay, so going back to those two main quantities that I said are of interest to convey prognostic information to patients, let's say we're interested in the 5-year probability of survival. So we can get this from our survfit object by passing it to a summary, and we have an additional argument that's times. You can supply a vector of times. I'm only interested in 5 right now, so I've just said 5. And what this is it's the point on the y-axis, the survival probability, that corresponds to where that survival curve is at 5 years. And we find in this example that our 5-year probability of survival is 81%. So this is a quantity that is commonly calculated incorrectly. You'll see this in the literature all the time. If someone doesn't know there's a time component to their data or doesn't know the right way to analyze it, a common way to estimate this incorrectly is just to do what we did in our simple example where there wasn't any censoring. And say, in this example, we had 297 patients who were dead at 5 years. The denominator would be the full sample size, 2,119, and you would estimate that you have an 86% 5-year probability of survival. And you see that you get an overestimate here because it's ignoring the fact that 968 patients were actually censored before that 5-year point. So at 5 years, for those 968 patients, we don't actually know if they're dead or alive. And so just putting them in the denominator like that will result in an overestimate of your survival probability. So the second quantity that's of interest is some estimate of the time, the average time that patients survive. And we get this from a median survival time, which you can obtain just by printing out your survfit object. And what the median survival time is it corresponds to the point on your x-axis, your time axis, at which there's a 50% survival probability, according to your survival curve. And in this example, we find that that is 12.7 years. So this is another quantity that's very commonly calculated incorrectly, and you'll see this in the literature all the time, and I have doctors come to me all the time with these numbers, and they're like, oh, I've calculated it myself. No, you haven't. But the way this is commonly incorrectly calculated is just to take the patients who died, so in this example, we have 476 patients who died, and to just estimate the median time that it took before they died. And in this example, you would say that the median survival time was 3.5 years. Now you can see that as a severe underestimate of our 12.7 years that we get when we analyze this correctly. And so making these kinds of mistakes in your data can have bad consequences in terms of communicating this information to patients. And this occurs because this calculation ignores the fact that censored patients also contribute follow-up time, right? So if a patient was censored at 10 years, we don't just throw out their data and say, oh, it doesn't tell us anything about median survival time, right? Because you might not know how long it was until that patient died, but you know that they lived for 10 years. And so that information has to contribute to your estimate of this median survival time. So another thing that is commonly of interest in a survival analysis is to compare survival curves between groups. And in this kidney cancer data that I'm talking about, our main question of interest was actually whether there was an association between BMI and survival. And this question was of interest because it's well known that BMI is a risk factor for kidney cancer. So being overweight or obese is a risk factor for getting kidney cancer. But among patients who have kidney cancer, it's been observed that actually being overweight or obese is associated with a better prognosis. And this is an idea that's known as the Obesity Paradox, and it's common across many diseases, and it's being studied a lot right now. So we just wanted to look at this question in our own data. So you can see that my code is pretty similar here, except in the first line on the right-hand side of the equation, now I have a variable for BMI. It's a categorical variable with 3 levels for normal weight, overweight, and obese. And now on my survival plot, I have 3 curves. The purple one is obese, the orange is overweight, and the green is normal. The risk table at the bottom has 3 rows, 1 for each of my groups, and now you can see there's been a p-value added to this plot. And this p-value comes from the log rank test. There are many other ways of testing the differences between survival curves, but I think the log rank test is probably the most common. And what it does is it equally weights across the whole follow-up time to test the differences between those survival curves. And there are versions of this test that could also weight more heavily the early or the late parts of follow-up if there was some reason that that was more of interest for your question. And this p-value comes from the survdiff function in R, which you can just pass your formula to that to obtain this p-value. And so in this case, we do find a significant p-value, so we would conclude that in our data, the BMI is associated with survival. And by looking at the curves, there is evidence that the overweight and the obese groups have their curves shifted up, and so they do seem to have better prognosis in our data. Another way of testing for differences between groups is to fit a regression model. A common regression model that would be used for this is a semi-parametric model known as the Cox regression model. There are also many parametric forms of regression models available for censored data, but I'm not going to get into those today. So we would do this using the Cox pH function. So similar syntax as what we saw before using survfit. And commonly, you would want to do a regression model like this because you would be interested in a multivariable model. You can imagine that in survival analysis, there are many variables that are associated with time to death. It easily comes to mind that age and sex are variables that are associated with how long people live. And so if you wanted to say something about a variable, you would want to adjust for these important confounders. I'm just showing a simple example here, focusing on the BMI still. So if we print out a summary of our Cox regression model fit, we would get regression parameters. And if we exponentiate those, we end up with a hazard ratio. And when you're dealing with a categorical variable like BMI, you have to have a reference group. So one of the groups has to be fixed at 1, and then your other hazard ratios are in reference to that. And a hazard is an instantaneous probability of death. And then a hazard ratio is the ratio of 2 different hazards. And a hazard ratio greater than 1 represents an increased hazard, and a hazard ratio less than 1 represents a reduced hazard. And you can see here that both our overweight and our obese groups have hazard ratios less than 1, suggesting that they have reduced hazards of death compared to the normal weight group, and our p-value is the same as it was before. Okay, so what really is a hazard ratio, though? So they're kind of hard, like, oh, instantaneous hazard of death. Well, what does that mean? Hazard ratios are very commonly misinterpreted, and the most common misinterpretation that I see is if we focus on our example comparing the obese to the normal weight group, the hazard ratio was 0.64, And you'll commonly see an interpretation of this as a 36% reduced risk of death. But hazard ratios aren't really risks. So we can kind of get an idea of why this estimate of a 36% reduced risk of death doesn't make sense in our data by looking back at our survival curve. And the first thing to think about is the fact that these curves are somewhat parallel and they're all going down. So what does a 36% reduced risk of death mean for one of these groups in that context? And the second thing to think about is that if we look back at our 5-year and 10-year estimates for the normal weight and obese groups, we see that those estimates only differ by about 11 to 12%. And so, again, that doesn't really correspond to a 36% reduced risk of death. So this is a common misinterpretation of a hazard ratio I see. Personally, I think they're hard to interpret, and I like to use Cox regression models to understand directions of effects in multivariable models and significance in multivariable models, but I like to use these other quantities to convey more information about actual differences between groups. So the last topic I'm going to cover is conditional survival. So one of the amazing things that's going on in cancer research right now is that treatments are improving, people are living longer and longer, we have more targeted treatments and more immunologic treatments, and patients are being cured. And so now it's of interest to ask the question, well, does that 5-year probability of survival that we estimated at the time of surgery, or whatever your start time was, we estimated 81% in this example, does that really still apply to a patient who's already lived for 1 year, or 5 years, or 10 years, you know? And they still want to know something about what their prognosis is. Well, the answer is no, but we can quickly and easily correct for this by estimating a conditional survival estimate. And this is the only formula I'm showing in my talk today, and it's just division, so don't worry too much about it. But the S represents the Kaplan-Meier estimate of survival, and if Y is our number of additional years of interest, and X is the number of years a patient has already survived, we can simply divide the Kaplan-Meier survival estimate for the total amount of time by the Kaplan-Meier survival estimate for the number of years a patient has already survived to get a conditional estimate. And if we do this, in our example, the table on the left-hand side has the number of years already survived from 0 through 4, and then we're interested in the probability of surviving to 5 years. So for someone at baseline, at time 0, that's our estimate of 81% of surviving for 5 years. At 4 years, this would be the probability of just surviving 1 additional year, and you can see that these estimates of survival go up as time goes by. And we can also see this by the plot of conditional survival estimates, where each color represents an additional year survived. And we can see that these survival curves are just shifted up as the time goes on. And so it's important to be able to update these survival estimates if you're giving this information to a patient who's already lived for 3 years. What's their probability of surviving to 5 years? So just a quick plug for a little R package I have that does this. It's called Conserve. It's available on my GitHub page, and there's a tiny, tiny link to the bottom of it on this slide. And these calculations are really straightforward, but my package will give you these estimates and these plots, and if you ever want to do this, it's a nice little easy way to do it. So that's all I have for you today. My code and data and slides are all available on GitHub, so you can play around with this if it's of interest. And I'm just going to leave you with some contact information and also a reference to the original publication of the kidney and BMI data that I talked about today. So thank you very much.